Iṣẹ́ yìí mo jogún ẹ̀ lọ́wọ́ bàbá mi.
I inherited this work from my father. He was an oracleist. He taught me Oduifa and everything about oracle, but my mother specialized in the making of herbal drinks. Apart from the belief that an Ifa priest is an authority in herbal works, it's a job I really admire, and I have no regrets since I started. My mother has never told lies in the job, and that's the path I am following as well.
I started business with 1983. Some children, then we deliver them, their bone not strong. I prepare herbs and roots and leaf to give the mother to go and cook and bake and give to drink. I met one doctor when he bring our daughter come here. This daughter don't pass 1 year, 6 months. It not walk, it not sit. I said, by grace of God, let them give me 2 days. If I finish my prayer, I will cut them. When I pray finish, then show me the leaf where I will cut for them. And I enter bush, I cut the leaf. I cook it with my herbs when I have in the shop. I give to the father. Then carry the medicine, go. Then prepare it, start to give him the baby. After the baby took for 2 years, he stand up.
Right now, as I speak to you, she has prepared and brought the traditional medicine. I have taken mine. Many people with malaria, typhoid, and infection come to patronize her in the market.
There is no traditional medicine I won't use. They are all good. Sometimes, I don't have money to go to the hospital, and I want quick remedy. There are some things that will be happening to you. If you squeeze plants like clove basil and bitter leaf and juice it, it can wash out sugar from the body.
Traditional medicine has a long history. It is the sum total of the knowledge, skill, and practices based on the theories, beliefs, and experiences indigenous to different cultures, whether explicable or not, used in the maintenance of health as well as in the prevention, diagnosis, improvement, or treatment of physical and mental illness. 88% of all countries are estimated to use traditional medicine such as herbal medicines, acupuncture, yoga, indigenous therapies, and others. 60% of the world's population depends on traditional medicine, and 80% of the population in developing countries depend almost entirely on traditional medicine practices and herbal medicines for their primary healthcare needs.
Traditional medicines are a set of belief, a set of practice, a set of skills that are indigenous to a certain culture to prevent disease condition, to diagnose or to treat such a disease condition.
Everybody is used to the orthodox means of getting medical attention, but the traditional way is the way that have been used by our ancestors, our fathers and forefathers, and they were getting the desired healthcare needs.
I met a doctor who owns an hospital. He comes here, he buys this and processes them as drugs, and they use it. These stuffs are medicinal, but we underrate the things we have. We don't know their uses.
I've seen a situation where there was a gunshot, and the bullet was deep down into the leg of the victim, and the orthopedic practitioners were finding it difficult to actually remove these bullets. They wanted to go through surgical laceration, surgical excision to bring this bullet. But at a certain time, some of the caregivers, relations of the patient, thought of a certain traditional, practitioner, and they took this patient there. This man just put few leaves together. He squeezed the leaves and put it on the wound and started speaking some certain languages I would not understand. And eventually, the bullet that was deep down in the wound just came to the surface.
At the end of the day, they get better. First of all, it's cheaper for them, and then the rigors of staying in the hospital is also not there, because those people, they will either be going to their homes to be taking care of them. And so they have more than 10 cases of orthopedic issues that patients say, okay, they just live against medical advice and then they go and take care of themselves with the traditional bone setters and they feel okay at the end of the day.
Herbal medicine has become a popular form of healthcare, even though several differences exist between herbal and conventional pharmacological treatments. In Nigeria, Southwesterners refer to herbal doctors as Onishegun, who specialize in using remedies from nature, mostly roots, leaves, tree barks, as common remedies for regular illnesses. Knowledge is not only passed down from generation to generation, methodologies are also improved on, and new medicine formulated for new health challenges.
This one is better than paracetamol because when people think say the herbal medicine is not work or it's not good, you know, our olden days father and mothers, they don't understand, they don't have those. And how they are prepared the medicine is not neat, much like that. They put medicine in pots, maybe them not 1 minute, it dey for 3-4 days. It's herbs, you to smell. And then we say we should continue to be taking it like that, but not now.
When traditional medicine practices are used as an alternative to orthodox medical practice, we call them alternative medicine. But when they are used to complement, orthodox medicine, we call them complementary medicines. And when they are used as an integrated, practices into medical practice, the orthodox medical practice, we call them integrative medicine.
WHO reports that over 40% of pharmaceutical formulations are based on natural products and landmark drugs, including aspirin and artemisinin, originated from traditional medicine. The contribution of traditional medicine to national health systems is not yet fully realized, as millions of accredited traditional medicine workers, facilities, expenditures, and products are not fully accounted for. The big question is, why isn't traditional healthcare a bigger part of formal healthcare policy?
The only problem with maybe traditional medicine or traditional medical practice is the issue of standardization. Okay, what is the dose to use? So sometimes they say, okay, 1 teaspoon, morning, afternoon, night, this and that.
If you have to actually prescribe them or let me say recommend them to people, there's a need for standardization. People that practice this particular, medicine, because it is native and it's cultural, and in many cases it is transferred from generation to generation, they don't want to submit it to standardization because they want to have ownership of it. And they are afraid of, patents. They are afraid that when people take it over from them, they may not compensate them appropriately.
Before a medicine is actually brought out to be used, it goes through stages, what's called clinical trials, phase 1, phase 2, phase 3, phase 4. However, traditional medicine doesn't have that kind of privilege. It's like people have been using it and it's working.
I could remember in pharmacy school, there's a department where we actually learn something related to or something close to traditional medicine. We call that department pharmacognosy, where we extract medications from fruits or from herbs, the roots of trees, the bark, and from the leaves, and sometimes from fruits or flowers of trees. We also use mineral resources as a source of medicine, and we use animal extracts. For example, toad or frog, they have some certain glands on their body where you can actually, extract acetylcholine, which is a factor, a kind of medication that we can use in orthodox medicine.
Traditional medicine has been an integral resource for health for centuries in communities around the world, and it is still a mainstay for some with inequities in access to conventional medicine.
These people that do not have access to the orthodox medicine, they need to be taken care of. And they find that traditional medicine is accessible, is also affordable, and they can relate with it. Even the World Health Organization is thinking, there are documentations with the fact that traditional medicine should be encouraged in the rural area so that rural people can access medicine.
Many times they are native to the culture and people are used to it. And people feel more comfortable using it. And many of them, you cannot trace a certain side effect to them, unlike the, orthodox medicine.
Our native dogonyaro is actually a treatment for malaria. And even we have been able to extract the active ingredient in that dogonyaro. That's what neem leaves. And then the chemical company is called azadirachtin.
Many of their resources can be sourced locally. They don't have to travel to get the resources. And they are largely, natural. For example, some herbs that are used, that are taken or imbibed, inhibition, in order to take care of some certain ailments, they are biodegradable.
The socio-cultural practice and biodiversity heritages of traditional medicine are invaluable resources to evolve inclusive, diverse, sustainable development.